Allie spent over a decade living with IV meth addiction and surviving on the streets. Her life experience fuels her mission to change how healthcare systems treat the most vulnerable. Allie now combines her clinical experience with her personal journey to educate, inspire, and challenge medical professionals to meet patients where they are, with empathy, dignity, and respect. Her story is a powerful reminder that no one is beyond redemption and that healing is always possible. Please help me welcome Allie.
I'm going to take this off because I move around a lot. Anyway, hi, my name's Allie. Thank you so much, Peggy. Like she said, I was born and raised in Alaska. I'm from Seward, and this talk is going to include discussions of sexual assault, drug addiction, homelessness. So if that's not your jam, I won't judge you if you want to walk out. I was raised in an awesome family. My parents instilled in me a love of the outdoors and all the things that sort of make Alaskans Alaskans. Unfortunately, I believe that I was also born with a propensity for addiction, and that caused me at about the age of 14 just to sort of drop out internally. I always felt like something was missing. I would look at people and wonder how you could just be happy, just walk around feeling happy. And so when I joined the rave scene as a teenager, and I tried meth for my first time when I was 18, I felt like my missing puzzle piece, I had found it. I felt like a whole person, and I felt like the world made sense. And by the age of 19, I was shooting up, and I spiraled really quickly. As she said, I was a sex worker to pay for my drug addiction. I was homeless, and eventually I wound up on the big island of Hawaii, where I was well known as a drug dealer and a prostitute. And I stuck out pretty good. I had a shaved head, I wore wigs. My uniform was Daisy Dukes and a triangle top bikini, and I bombed around on a longboard. And if you don't know what a longboard is, it's just a really big skateboard that goes really fast. And I would also use it as, my mode of protection, as a way to, encourage people to pay me back the money that they owed me. So if you've never been chased down the street by a 120-pound meth addict wielding a longboard, you just haven't lived. One day I was ready to sell some dope. I had it all in my backpack and my baggies and my scale. I was set. I had a plan. I was going to sell a bunch of dope, get a hotel, turn a bunch of tricks, buy more dope, do it over and over again. What I didn't have with me was a helmet or knee pads or shoes. I just wore flip-flops. And again, bombing down King Kamehameha Highway. If you're not familiar with Hawaii, it's a volcano, and it ends in the ocean. And I realized that I was keeping up with traffic, and I was like, oh God, if I don't fall or stop, I'm gonna die. And so I thought in my head, I can sort of gracefully tumble. That didn't happen. I splatted out on the side of the road, which was lava rock. And right before I blacked out, I saw the skyline bounce, which was my eyes rolling into the back of my head. When I came to, I realized, I was like, man, it must have rained, because my hair was soaking wet and it was all just covered in blood. My first thought was not, oh my God, I need some medical care. It was, I gotta get out of here. Because my backpack had 25 to life in it, and I did not want to go to prison. Unfortunately, there was a traffic jam because a whole line of people just saw a woman die, and I was not sneaking out of there unnoticed. So I accepted my fate, that I was going to have to speak to some medical professionals, and I thought, if I give them my stripper name, they won't associate me with this bag of drugs. And so the sirens came and the paramedic came out, and it was somebody I knew very well. He came up and asked me my name and date of birth, and I told him Ava Castelli, which was my stripper name. And he looked at me and he said, Allie, that's not your name. And if you don't start being honest, I'm gonna leave you on the ground to bleed out. Now, at this time, I didn't know that I had rights. I didn't know about EMTALA. I didn't know that what he had said to me was not only immoral, it was illegal. All I knew was that a man, a person in position of power in a uniform, who had the ability to choose whether I died or lived, who had the ability to choose whether I went to prison or not, was threatening me. So of course I shut my mouth, I listened, I got in the ambulance. They took me to the Kona hospital where they gave me two options. Option one, staple your head closed. Option two, lidocaine injection, staple your head closed. And the way that the provider laid it out for me was like, you know, you could get the lidocaine, but it kind of hurts too, so you know. I knew he just wanted to staple my head closed and be done with me. So I said, sure, I'm a tough girl, staple that thing closed. And that's what we did. Wham bam, thank you ma'am, no other care, no education on like traumatic brain injury or what I might be expecting afterwards. This was not the only situation, right? So another time I was on my skateboard again, you know, and I fell and I heard something snap in my wrist. And I went to the hospital, they wrapped it up in an ace bandage and gave me an Ativan. The nurse looked me in the eye and said, there's nothing wrong with you, stop crying. And 6 months later, I was still having a problem with the wrist. And I went to a different hospital, and they said, yeah, you have an unhealed, or a poorly healed skateboard fracture. And they said, well, we're gonna have to re-break it and put you in a full arm cast for 6 to 8 months. And I was like, well, here's the thing, I'm an IV drug addict and a homeless person. I don't think having a full arm cast is really gonna work for my lifestyle. So I declined care, because, I mean, but had I received the correct care in the first place, that wouldn't have had to happen, right? So the truth is that this is not rare for somebody that presented like myself. A homeless person who is a frequent flyer, who is obviously on drugs. This is not rare, it is horrific, and it was horrible. And this, among many other interactions with first responders, led me to believe that nobody gave a crap about me. And so, when I was kidnapped and raped, I didn't tell anybody, because who would have cared? You can't rape a prostitute, that's what I was told. So I kept silent, and I laid on the ground in the worst pain of my life, and I heard that man's words replaying over and over and over in my head. Just gonna leave you on the ground to bleed out. In 2015, miraculously, I got clean. I went cold turkey off meth, and I was working my first real job in 13 years as a housekeeper in a hospital. And my coworker, friend, he said, he showed me this poster on the wall, and he said, hey, they're going to have an EMT course. You should do it. And again, I thought of this freaking guy who told me he was going to leave me on the ground to bleed out. And I was like, yeah, I'm going to show this guy. I'm going to become somebody. And so I did. I worked my butt off, and I kept him in my mind. You know, getting a degree out of vengeance is valid. It's valid. It doesn't have to be altruistic. And so, equal parts determination and vengeance, I did pass that course. And I was on my first ride along in an ambulance and with a paramedic. And we got called to a house of well-known drug addict and domestic violence people that had been called many, many, many times. There was a water behind this drum the whole time. Anyway, so we got called out to I just sound like great, that's great. It's gonna look great on film. We got called out to this house, and the whole way there, the paramedic is saying, oh, man, these effing junkies, I don't want to touch her, she's probably got hep C. And I was sitting there dutifully as a new grad, a new EMT, with my mouth shut, and when we got to the house, I said, "I'll go assess her." And so I did. I jumped out of the ambulance and went to this woman's house, and she was high as a kite. She was. And she stripped down naked, and she threw her leg above her head, and she showed me her vagina, and I was not fazed at all. In fact, I was just happy to be there, to be honest with you, to look her in the eyes and to listen to her words, to what she had to say. And she eventually declined to be transported, but I think that she got what she needed out of that visit, which was to have somebody listen to her and care about her and look her in the eyes. And as we were in the ambulance on the way back to the station, I was just filled with this glow of purpose, and I knew what I was called to do. And I was like, I'm gonna go to nursing school. And so I did. I was 35 years old in a room full of teenagers. And we're all still really good friends today. We communicate on Snapchat. It's true. If you're not too old to go to nursing school, you're not too old for Snapchat. And I worked my butt off. And I got my ADN, and I went straight back and got my BSN. And I came back home to Alaska. And I started working again, and I was offered a job opportunity which I was not qualified for. I didn't know what a nurse case manager did, but I told the person that hired me, who's now my boss, but guess what? She freaking believed in me. She believed in me. And I've been the chair of the ANTHS Case Managers Committee for longer than we're supposed to be, I think. But I love that committee. I love being plugged in, and I love my job. And oftentimes I tell my therapist, I don't think I'm a nurse anymore. I couldn't start an IV. I don't even know if I could save anybody's life. And she says to me, Allie, what is your goal as a caregiver? And I say, to give the care that I never received. And then she says, did you do that today? And I'd say 99% of the time, I can say yes. Yes, I did. And there is a temptation to pretend that 2012 Allie never existed, to just pretend I never lived that life. Because she is messy, she gives me nightmares, she makes me cry, she does not look good on a resume. It was really hard for me to get my Alaska nurse's license because you have to show your entire life's history of criminal conduct. It's really difficult. But what 2012 Allie does is she keeps me humble. She keeps me empathetic, and she makes me real. And just recently I was in the village, and I was meeting with one of my patients who is a chronic no-shower, right? Somebody who, and as a case manager, I do care coordination. I bundle 8 million appointments at once so that we don't have to make people travel to Anchorage. And it's like I am a type A person, and they're gonna go here, and then they're going to here, and then they're going to here. And any little deviation from Allie's plan can cause Allie to feel some type of way. And when you have somebody who constantly no-shows, it gets me a little perturbed. And I was doing an intake, and I got to her social history, and she very proudly says, I have not touched alcohol, tobacco, or drugs in 40 years. And I said, that is freaking awesome. You know what? April 29th, I made 10 years clean from meth. And I told her I did meth for 13 years. And this woman I have been communicating with as a patient for 3.5 years. She got real silent, and she got some tears in her eyes, and she said, I had 2 daughters that struggled with substance abuse, and they both were murdered in Anchorage. And I closed my computer, and I sat with her, and we talked. And she said, this is why I hate going to Anchorage, because I am terrified. And when I tell you that the scales fell away from my eyes, because I was vulnerable with her, she was vulnerable with me, and that dialogue created an opportunity for me to change my freaking my care plan to change the way I provided care for her. And this is trauma-informed care. And this is what lived experience makes possible. And so what my journey has taught me, and what I hope that you can carry with you, is that being an addict does not make someone less deserving of care. You can be a drug addict and still need pain medication. You can be in the throes of addiction and still deserve dignity, compassion, and high-quality medical treatment. Substance abuse does not take away someone's humanity. And for those of us that have lived it, and we carry the scars and the stories, we have the ability to provide care that is truly transformational. Our history is not a deterrent, it is an asset, it is a bridge. It shouldn't be something we're ashamed of. Because we can often see what others miss or ignore, and we can hear what others dismiss. Sometimes we can show up in ways that will rebuild trust in a community. And that's the type of nurse that I want to be every day. And this is the kind of healthcare system that we can all create together. One that is rooted in empathy, equity, and honesty. Thank you so much.